Oh, Johanna, it's so good to see you. I am so thrilled that we are taking about 30 minutes here for our coffee break together. And because I just want to find out more about you, Johanna. You who are one of our newest commissioners to join the team last year. So that's thrilling to have you on board. And, having met you, but now getting to know you further and deeper, it's just a pleasure to be here with you today. And I hope you have your coffee standing by as well so that we could be imbibing respectively together.
I have my
Welcome.
tea. I have my tea. Thank you. It's an honor and a pleasure, especially to have this conversation with you, Zoe.
Well, thank you. And I guess I want to start it off with one very simple question. Do you remember how we actually met in person?
In person, yes, because you came up to me at a training of trainers and introduced yourself very enthusiastically. Um, and we just sort of hit it off and have had regular contact ever since. Although, have we seen each other in person since then? I'm not even sure.
You know, I don't think so,
Yeah,
actually.
it's
Strangely enough, the
our that's
since
our
then
digital
has
life now.
right now we're on. It's Zoom. It's texting. We're doing a lot of texting lately, you and
Hmm.
I. And I remember just going back to that in person. I remember just being excited to be able to go up to you in person because we had been in touch prior to that remotely, and recognizing that you weren't so much taller than I was. I mean, I tend to be the shortest person in the room, anyways. But it was kind of gratifying to know that
Mm.
you had only a few inches on me.
Yeah, yeah.
So it was wonderful for me too. And with that, that idea of meeting, connecting, I'm just wondering, in your case, in your journey, how the connecting happened for you as you engaged and delved deeper into language access.
Yeah. Um, so I guess my journey was sort of has been a series of happy accidents. Um, because I knew some conference interpreters, I ended up studying conference interpretation and translation in graduate school. Um, and I took classes in conference interpreting, some electives in court interpreting, but there were no medical interpreting classes and no healthcare interpreting classes there. And I ended up doing an internship because it was the only interpreting internship that I could find at a hospital. And my plan was, well, I'm going to learn a lot of vocabulary and I'm going to be a conference interpreter who can do medical conferences. And it didn't even dawn on me that I was going to really find fulfillment in healthcare interpreting. And I do. It's where my heart is, and it fulfills an important need for me to be contributing to society and my community in a way that I don't feel with conference interpreting. Although I'm glad to still have conference interpreting on my list of work areas and diplomatic interpreting. It's exciting. It's fun. It's meaningful in a different way. But with healthcare interpreting, there's that daily reward of seeing the relief on people's faces or the gratitude when you provide this service for them. And I've also found it very rewarding to be an instructor and a trainer and work on increasing the skill level for healthcare interpreters as much as I can.
And I wonder also, in terms of in your work, in your day to day work over the last 3 years, how that's expanded your vision of what is possible and how you bring that into your trainings as well.
Over the last 3 years in particular,
It just because I'm thinking, yes, we all talk about what COVID has done, how it's impacted the healthcare arena. This is something that I'm sure it has been on your radar and your plate since this has happened, and how you bring that into the fold when it comes to how you engage both as a trainer, as a leader in your healthcare organization. And that is something I wonder about how it's been for you personally and professionally.
yeah. Um, so I'll start with professionally. Professionally, I have done I've worked with the leadership of my department and a team that has done a lot of work around the move to increased remote interpreting. For better or for worse, it's an important modality. I am fortunate to work at an institution that recognizes the importance of face-to-face interpreting, and it has not in any sense eliminated it. I know that other institutions haven't had that experience. But initially in 2020, there was this, there was this rush to adapt to different remote platforms. And so I did a lot of work around training our staff on those platforms, and also training the providers how to use them. And I think that that's where there's a lot of work to be done, is training both interpreters and providers and hospital staff on how to best provide language access using remote modalities, because calling an interpreter on a speakerphone across the room when it's really noisy and everyone's talking at the same time just doesn't really create the best language access context. I also, in my training, I've continued to train interpreters and have focused more on those modalities. I'm fortunate to be teaching at the institution where I studied, the Middlebury Institute of International Studies, and I hope that the pandemic has shed light on the value of language access, because I think we saw that when family members weren't allowed in rooms, all of a sudden the language needs shot up, and we saw how the pandemic really brought to light and increased disparities in care, and we saw how Black and Brown communities were the most affected by the pandemic, and we also saw the shortage of interpreters, and we saw interpreters working on the front lines, many of whom are immigrants themselves. And I hope that as an industry, the pandemic will help us recognize the value of the work of healthcare interpreters. So that's sort of on a professional level. On a personal level, I suffered a lot of personal loss during the pandemic. My mother passed away unexpectedly right before the pandemic. My father got sick, and I was his caregiver for a year, and then passed away earlier this year. And so, like many who experienced personal loss during the pandemic, it just sort of layered on top of the stresses that we all have been feeling. And so when you ask, what have I been doing in the last 3 years? The truth of the matter is, I've done what I can, but I've also taken a step back. And I think I've really learned the importance of, self-care and of taking breaks. And, I've always been very much a professional go-getter. Like I go to as many conferences as I can. I present at as many conferences as I can. I, seek different opportunities. And, we've talked about self-care and burnout for years in and vicarious trauma in our profession, but I've learned on a very personal level what that really means, and am still trying to figure out for myself how to best care for myself during these times.
And and I think that for our audience, they could on many levels relate to exactly what you're talking about, and how you navigate that individually, I think, will be unique to each person,
Of
for
course.
sure. So, um, and yet you, who are somebody who I remember gave the keynote uh, presentation speech at the 2019
Mhm.
summit for CCHI, you you had a wonderful way of in your speech talking to this idea of raising the bar. So that raising of the bar with all that you have also come to understand about loss, trauma on a personal level, um, where does that raising the bar concept still propel you on some level or allows you to take a step back and then come back to it as you are ready to do
Yeah.
so again? I wonder about that.
Yeah, I still so firmly believe in that vision that I set forth of we need to raise standards across the board for all languages within individual language groups. We need increased remuneration. We need better understanding from administrators and lawmakers. All of these things, we need to raise the standards both sure for interpreters, but we it's not about us, it's about the people that we provide the service to. um and and so so and of course things have changed significantly in the last 3 years, and the path that we're going to take to get there, or the multiple paths that we're going to take to get there, are necessarily going to be different. But it's a vision that I still firmly hold. um, in my present, I'm not playing particularly a leadership role in making these changes. And I think it's been really good for me to take a step back and just be more reflective and admire the work that others are doing. There's incredible work being done in different in different arenas. The work that Andrea is doing on interpreter fatigue, that was talked about in the last coffee break. Um, I just attended a conference and saw some incredible presentations what to do about the I saw an incredible presentation about medical misinformation and how that affects the role of the interpreter. um, the discussions that are happening about outsourcing, and about remote interpreting in general. um, I'm just sort of observing and admiring right now, and taking care of myself so that I have the strength to jump back in, because it's a marathon, right? It's not a sprint. And um, burnout is so very real for so many people. And if we're not aware of it, it's really easy to get burned out, even doing something that we're passionate about. And I think it's also important to just find the joy in the day to day, in daily interactions with patients and providers. um, and knowing that all of that, being a good interpreter and engaging professionally is a little piece of that raising the bar, and recognizing and appreciating that it doesn't always have to be the big things.
And little things make a big difference. That's the
Yeah.
bottom line too. So I appreciate what you're saying when even the day in and day out of being a good interpreter, how that satiates that vision for you right now
Hmm.
in your present and taking a step back. And I'm curious about when you take that step back or in those moments of finding something small that gives you pleasure on the in your personal life. What can you give us an example of what that is
Sure.
right now for you?
Right now, there are a lot of YouTube videos of animals. Right now, there are audiobooks and walks, swimming, baking, things like that. And there's also just a lot of reflection. My parents were amazing people. They both fought for social justice issues in different movements their whole life. And by reflecting on who they were and their values and the values that they instilled in me, it also helps me um, frame for myself who I want to be, both personally and professionally, as I move forward and as I adapt to the new reality. We're all adapting to a new reality of the pandemic. We can't say it's over because it's most certainly not, but we're trying to. There's really, especially this year, there's this sense of, okay, we're moving on with our lives, um, but things aren't quite the same. And obviously, for me, things aren't the same because of the loss of my parents. But I'm using this time to think about them and who they made me um, into and who I want to become.
And that's something that checking in with self is something that I think is very valuable at whatever stage you may find yourself in your life. So having the opportunity to do that is profound. Uh, and
Mhm.
so I think that is something that many of us in our different phases where we find ourselves at different times, if we can, doing that for ourselves so that we can continue to achieve and make a difference is
Mhm.
tremendous.
Yeah,
So,
yeah.
yeah. Um,
I think, and my parents, I'm just realizing how much the values that they instilled in me have shaped me in ways that I didn't realize. You know, that for me, one of the reasons I find training interpreters so rewarding is that I'm working with often immigrants, and giving giving them training so that they can enter a field that allows them to give back to their community, um, and um, and really fight in our own way, in our small way, in our little corner of the world um, for a more just and dignified life. I mean, everyone deserves access to healthcare. Um, everyone everyone deserves sort of a fair shot. Um, and so thinking about them reinvigorates me to go back and do this work that I have been so passionate about. And right now I'm taking a step back because I'm burned out, and but I know I'll be back with a vengeance uh, soon. Yeah.
and I, for one, look forward to watching you as you continue in your way, in perhaps a reinvigorated in a whole on a whole new level, because you've had the wherewithal to take this step back and
Mhm.
giving yourself a chance to re-energize. So I'm there. Where could I get the
Thanks.
tickets?
Thanks.
So I wonder if there are any last words that you would care to share, Johanna, because we're almost at our point of saying goodbye. Not quite yet, but whatever you care to sign off with would be great.
No, just thank you. If anybody is watching this and feeling that FOMO, that fear of missing out, like you're not doing enough professionally, um, know that you're doing enough. That's something that I've definitely felt, that FOMO, uh, and in the past as well as now, and I've really learned the lesson that it is okay to not always be doing all the things, that career will be there, and that what matters most is your personal satisfaction, and finding joy, whether it be through your work or away from your work.
Well, I'm definitely going to add on another coffee break as part of my moment of joy. And
Great.
sometimes I have dark chocolate with it as well.
Excellent. Good call.
And I want to thank you once again, Johanna, for taking a little bit of time and be with us here today. So thank you so much. It's been a real pleasure.
Thank you.